In a move that has captured both domestic and continental attention, Burkina Faso's interim president, Captain Ibrahim Traoré, has launched an ambitious initiative to transform the nation's healthcare system. The young leader, who assumed power in a 2022 coup, is spearheading the construction of new health clinics across the country, with a vision to treat all health challenges domestically, eliminate reliance on foreign medical systems, and bolster the nation's economy. This initiative is not only a bid to improve healthcare access but also a strategic effort to retain talent, generate revenue, and reduce the brain drain that has long plagued Burkina Faso's medical sector. Since taking office, Traoré has positioned himself as a champion of economic and social self-reliance, drawing inspiration from Burkina Faso's revolutionary icon, Thomas Sankara. His latest healthcare initiative aligns with his broader agenda of reducing dependency on Western institutions and fostering national sovereignty. The vision is to provide healthcare to Burkinabe wherever they are, Traoré declared during a ceremony in Ouagadougou on July 25, 2024, where he handed over medical equipment to health facilities across Burkina Faso's 13 regions. The equipment, including 1,900 solar-powered refrigerators, 14 generators, and 15 mobile clinics, is part of a broader strategy to strengthen primary healthcare and bring services to remote and underserved areas. Traoré's administration is now scaling up this effort with plans to construct over 50 new health clinics nationwide, a claim that has sparked widespread discussion online and in local media. These clinics aim to address a wide range of health challenges, from maternal and child health to chronic diseases like diabetes and infectious diseases such as malaria, which remains a significant burden during the rainy season. The initiative emphasizes local treatment capacity, with Traoré explicitly stating that Burkina Faso should no longer rely on foreign hospitals for advanced care. "We cannot continue to send our people and our resources abroad for treatment," he said in a recent address. "Every franc spent in Western hospitals is a franc we can invest in our own system, our own doctors, and our own future." The healthcare push is designed to serve multiple purposes beyond improving public health. By building a robust domestic healthcare infrastructure, Traoré's government aims to redirect funds that would otherwise flow to foreign medical institutions. Burkina Faso, like many African nations, has historically seen significant capital flight due to citizens seeking treatment abroad, particularly in Europe and North America. These expenditures, often in the millions of dollars annually, represent a loss of resources that could be reinvested locally. By treating patients domestically, the government anticipates generating revenue through a self-sustaining healthcare system, where fees for services, kept affordable for Burkinabe citizens, will remain within the country. This revenue is expected to have a ripple effect. First, it will enable the government to pay healthcare workers competitive salaries, addressing a critical issue in Burkina Faso's medical sector: low wages. Doctors, nurses, and technicians in Burkina Faso often earn significantly less than their counterparts in Western countries, leading to a persistent brain drain. Many skilled professionals leave for better opportunities abroad, depleting the nation's healthcare workforce. Traoré's plan seeks to reverse this trend by improving working conditions and offering salaries that rival those in wealthier nations. "Our doctors and nurses are among the best, but they leave because we undervalue them," Traoré noted. "By keeping our resources here, we can pay them what they deserve and keep them home." The initiative also includes investments in training and capacity building. The government is reportedly planning to establish medical training centers alongside the new clinics, ensuring a steady pipeline of skilled professionals. These centers will focus on specialties such as oncology, cardiology, and infectious disease management, reducing the need for Burkinabe patients to seek specialized care abroad. By fostering local expertise, the initiative aims to create a virtuous cycle where improved healthcare services attract more patients, generate more revenue, and fund further improvements. The cornerstone of Traoré's healthcare strategy is the deployment of mobile clinics and fixed health facilities equipped with modern technology. The mobile clinics, funded in part by a combination of grants and loans from the Islamic Development Bank (IDB), are designed to reach rural populations far from major hospitals. Costing over 5.6 billion FCFA, approximately $9.5 million USD, these clinics are equipped with refrigerated vehicles for vaccine delivery, solar-powered storage for medical supplies, and digital tablets for telemedicine and record-keeping. Additionally, programs like free cataract surgeries for 4,000 patients demonstrate a focus on tangible outcomes that improve quality of life. Fixed clinics, meanwhile, are being constructed in both urban and rural areas, with a reported goal of at least 50 new facilities. While some sources have claimed this number is already achieved, others suggest the figure may be aspirational, with construction ongoing and timelines unclear. Regardless, the government's investment in healthcare infrastructure is part of a broader economic strategy that includes nationalizing gold mines, building a gold refinery, and boosting agro-processing, all aimed at retaining wealth within Burkina Faso. The revenue from these sectors is being channeled into social programs, including healthcare, to create a self-reliant economy. The brain drain issue is particularly acute in Burkina Faso, where the loss of medical professionals has strained an already fragile healthcare system. According to posts on X, Traoré has publicly emphasized retaining talent, stating that Burkina Faso's most talented and best brain youth will stay to build the country rather than work abroad. This rhetoric resonates with a population frustrated by decades of dependency on foreign systems, but it also underscores the practical challenge of creating conditions that discourage emigration. By improving salaries, working conditions, and access to modern equipment, the government hopes to make staying in Burkina Faso a viable and attractive option for healthcare professionals. Moreover, the initiative includes plans to incentivize diaspora professionals to return. Traoré's administration is reportedly exploring programs to lure back Burkinabe doctors and nurses working abroad, offering them roles in the new clinics and training centers. This aligns with his broader Pan-Africanist vision of empowering local talent to drive development, a message that has gained traction across the continent. Africa doesn't need to beg for help, Traoré has said, echoing his rejection of IMF and World Bank assistance. We have the resources and the people to solve our own problems. A cornerstone of Traoré's vision is to curb the brain drain that has long depleted Burkina Faso's medical workforce. The country's doctors and nurses, often trained at significant public expense, frequently leave for better opportunities abroad due to low salaries, poor working conditions, and limited access to modern equipment. According to estimates, sub-Saharan Africa loses thousands of healthcare professionals annually to developed nations, with Burkina Faso particularly affected due to its economic and security challenges. Traoré's initiative tackles this issue head-on by creating an environment where doctors are incentivized to stay and serve their communities. The construction of new clinics, equipped with cutting-edge technology, will provide Burkinabe doctors with the tools they need to practice high-quality medicine. For example, the planned inclusion of diagnostic imaging, surgical theaters, and specialized wards for cardiology and oncology will allow physicians to treat complex cases locally, reducing the frustration of referring patients abroad due to inadequate facilities. This access to modern infrastructure not only enhances job satisfaction, but also positions Burkina Faso's healthcare system as a competitive alternative to foreign institutions. Competitive salaries are another critical component. By redirecting healthcare revenue to worker compensation, the government aims to offer salaries that rival those in wealthier nations. For instance, a doctor earning approximately 300,000 FCFA, $500 per month in Burkina Faso might currently be tempted by offers of $5,000 or more abroad. Traoré's plan envisions closing this gap, potentially doubling or tripling salaries for specialists and providing incentives like housing allowances or professional development opportunities. This financial empowerment is expected to make staying in Burkina Faso a viable and attractive option, reducing the allure of emigration. To ensure long-term sustainability, Traoré's initiative includes significant investments in medical education and training. The establishment of medical training centers alongside new clinics will create opportunities for young Burkinabe to enter the healthcare profession and for existing professionals to upskill. These centers will focus on specialties that are currently underserved in Burkina Faso, such as oncology, neurology, and infectious disease management. By training doctors locally, the government reduces reliance on foreign medical schools, which often lead graduates to stay abroad after completing their studies. The training programs are designed to be practical and community-oriented, ensuring that doctors are equipped to address Burkina Faso's unique health challenges. For example, the curriculum will emphasize tropical diseases like malaria and dengue, which are prevalent during the rainy season, as well as maternal and child health, given the country's high maternal mortality rate, approximately 320 deaths per 100,000 live births, according to recent estimates. By aligning training with local needs, the initiative ensures that doctors are not only skilled but also deeply invested in serving Burkinabe communities. Furthermore, the government is exploring partnerships with regional institutions, such as medical schools in Ghana or Nigeria, to facilitate knowledge exchange without compromising sovereignty. These collaborations could involve visiting professors, shared research, or access to advanced training modules, allowing Burkinabe doctors to stay competitive on a global level while remaining rooted in their homeland. Plans to incentivize diaspora professionals to return, through repatriation programs offering leadership roles in new clinics, will further bolster the talent pool, bringing back expertise gained abroad to benefit local patients. The healthcare investments also carry significant social and cultural weight. By prioritizing local treatment, the initiative fosters a sense of national pride and self-reliance, aligning with Traoré's broader Pan-Africanist rhetoric. For decades, seeking medical care abroad has been a status symbol for the elite and a necessity for those with complex conditions, reinforcing perceptions of African inferiority in healthcare. Traoré's vision challenges this narrative by demonstrating that Burkina Faso can provide world-class care. This shift could inspire confidence among citizens, encouraging them to trust and invest in their own institutions. For doctors, working in a system that values their expertise and provides modern facilities enhances their professional dignity. Instead of feeling marginalized in underfunded hospitals, Burkinabe physicians will have the opportunity to lead cutting-edge care, mentor the next generation, and contribute to national development. This sense of purpose is likely to resonate deeply in a country with a strong revolutionary history, where figures like Thomas Sankara emphasized collective effort for the common good. The initiative also has the potential to improve health outcomes, which in turn supports social stability. Better access to healthcare reduces mortality rates, improves workforce productivity, and alleviates the economic burden of untreated illnesses. For example, treating chronic conditions like diabetes locally prevents families from falling into debt to afford foreign care, preserving household wealth and reducing poverty. Healthier communities are also more resilient to crises, such as the ongoing security challenges in Burkina Faso's northern regions, where access to medical services is often disrupted. The healthcare investments are strategically linked to Burkina Faso's broader resilience against external pressures. By reducing dependency on foreign hospitals, the country insulates itself from geopolitical vulnerabilities, such as sanctions or restrictions on medical travel. This is particularly relevant given Traoré's rejection of Western aid and his pivot toward partnerships with non-Western allies, such as Russia and China. A self-sufficient healthcare system strengthens Burkina Faso's bargaining power on the global stage, allowing it to negotiate partnerships from a position of strength rather than desperation. Additionally, the initiative's focus on rural healthcare through mobile clinics addresses the needs of displaced populations, a critical issue in a country where over 2 million people have been uprooted by jihadist insurgencies. By bringing medical services to these vulnerable communities, the government not only improves health outcomes but also demonstrates its commitment to inclusivity, potentially reducing social tensions and fostering national unity. The ripple effects of these investments will extend to the structure of Burkina Faso's medical workforce. By creating a robust healthcare ecosystem, the initiative encourages specialization and professional growth, allowing doctors to pursue diverse career paths within the country. For instance, a surgeon trained in Ouagadougou could work in a new clinic in Dori, teach at a training center in Bobo Dioulasso, or lead public health campaigns in rural areas, all while earning a competitive salary. This flexibility contrasts with the current system, where limited opportunities often push professionals toward general practice or emigration. The emphasis on training and retention also positions Burkina Faso to become a regional hub for medical expertise. As the country builds capacity, it could attract patients from neighboring nations like Mali or Niger, further boosting revenue and establishing Burkina Faso as a leader in West African healthcare. This regional influence would enhance the prestige of Burkinabe doctors, making the profession even more attractive to young talent. While the advantages are significant, the initiative faces hurdles that could impact its success. The ongoing security crisis, particularly in the north and east, poses a risk to the construction and operation of new clinics, as well as the safety of healthcare workers. Ensuring that these facilities are adequately protected and accessible to displaced populations will require coordination with security forces and humanitarian organizations. Additionally, the government must address logistical challenges, such as supply chain disruptions for medical equipment and pharmaceuticals, which could undermine the functionality of new clinics. Sustainability is another concern. While redirecting healthcare revenue is a promising strategy, the initial investment, estimated in the billions of FCFA, requires careful financial management to avoid debt burdens. The government's reliance on nationalized industries, such as gold mining, to fund these projects introduces risks tied to global commodity prices and investor confidence. Transparent governance and accountability will be critical to maintaining public support and ensuring that funds are used effectively. Finally, the success of the training programs depends on attracting and retaining qualified educators and ensuring that curricula meet international standards. Without rigorous oversight, there is a risk that the quality of training could fall short, limiting the ability of Burkinabe doctors to compete with global counterparts. Traoré's healthcare initiative represents a bold step toward transforming Burkina Faso's medical landscape. By investing in clinics, training, and competitive salaries, the government aims to create a self-reliant system that serves the Burkinabe people, retains talent, and drives economic growth. The advantages, economic empowerment, improved health outcomes, and national pride, are far-reaching, but their realization depends on overcoming significant challenges. As the initiative unfolds, its impact on Burkina Faso's doctors and citizens will continue to shape the nation's path towards sovereignty and resilience. Captain Ibrahim Traoré's bold healthcare initiative, centered on building advanced clinics and fostering medical self-reliance in Burkina Faso, is not only transforming domestic healthcare but also positioning the nation as a potential regional hub for medical excellence. By equipping these facilities with cutting-edge technology and fostering a highly skilled medical workforce, Burkina Faso stands to gain significant international exposure, drawing patients from neighboring African countries and training doctors to rival the expertise found in global medical powerhouses like India. This strategic push could elevate Burkina Faso's reputation, enhance its doctors' experience, and drive economic and diplomatic dividends, all while addressing the nation's pressing health challenges. The cornerstone of Traoré's vision is to equip Burkina Faso's new clinics with state-of-the-art medical technology, including advanced diagnostic tools, surgical suites, and specialized treatment units for conditions like cancer, cardiovascular diseases, and infectious diseases. This investment in infrastructure, coupled with the deployment of mobile clinics and solar-powered medical equipment, aims to create a healthcare system capable of handling complex cases that currently drive patients to seek treatment abroad. By achieving this, Burkina Faso could become a magnet for patients from neighboring countries such as Mali, Niger, Togo, Benin, and even Ghana, where healthcare systems face similar challenges of underfunding and limited capacity. The potential for Burkina Faso to attract regional patients is significant. Many West African nations lack the infrastructure to treat advanced conditions, forcing patients to travel to Europe, North Africa, or as far as India for care. For example, Nigerians and Ghanaians often seek treatment in India for procedures like organ transplants or cancer therapy, spending millions of dollars annually on medical tourism. Burkina Faso's new clinics, if equipped with comparable technology, such as MRI scanners, robotic surgery systems, and radiotherapy units, could offer a closer, more affordable alternative. This would not only reduce travel costs for patients, but also position Burkina Faso as a competitive player in the regional healthcare market. The economic benefits of this regional draw are substantial. Foreign patients seeking treatment in Burkina Faso would contribute to the local economy through medical fees, accommodations, and related services like transportation and hospitality. For instance, a patient from Mali undergoing a surgical procedure in Ouagadougou might spend several $1,000s on treatment, lodging, and local services, all of which would remain within Burkina Faso's economy. This influx of revenue could further fund healthcare improvements, creating a self-reinforcing cycle of growth. Moreover, as Burkina Faso builds a reputation for quality care, it could attract private investment from regional healthcare providers, further enhancing its infrastructure and global standing. The influx of regional patients would provide Burkinabe doctors with unparalleled opportunities to gain experience and refine their skills. Treating a diverse patient population with a wide range of conditions, from tropical diseases prevalent in West Africa to complex surgical cases, would expose doctors to varied clinical scenarios, enhancing their expertise and adaptability. For example, a cardiologist in a new Ouagadougou clinic might treat patients from Niger with heart disease, gaining experience in advanced procedures like angioplasty or pacemaker implantation. Similarly, oncologists could develop expertise in managing cancers common in the region, such as cervical or liver cancer, through high patient volumes. This hands-on experience is critical for building a medical workforce that rivals global standards. In countries like India, doctors benefit from treating large numbers of patients, which accelerates skill development and fosters innovation in medical practice. Burkina Faso's initiative could replicate this model by creating high-volume, high-quality medical centers where doctors encounter diverse cases daily. The planned medical training centers, integrated with the new clinics, would further amplify this effect by providing structured programs in specialties like neurosurgery, orthopedics, and infectious disease management. These programs would incorporate real-world practice, allowing trainees to work alongside experienced physicians on complex cases, including those from regional patients. To ensure global competitiveness, the government is reportedly exploring partnerships with international medical institutions, such as universities in India or China, to facilitate knowledge transfer. These collaborations could involve exchange programs, where Burkinabe doctors train abroad in advanced techniques and return to share their expertise, or virtual training modules delivered through telemedicine platforms. Such initiatives would equip Burkinabe physicians with skills on par with those in leading medical nations, enabling them to perform procedures that were previously unavailable in the region. For instance, training in minimally invasive surgeries or advanced diagnostic imaging could position Burkina Faso's doctors as regional leaders, attracting even more patients and enhancing the country's reputation. India's status as a global medical hub offers a compelling benchmark for Burkina Faso's ambitions. India attracts millions of medical tourists annually, particularly from Africa and South Asia, due to its combination of advanced technology, skilled doctors, and affordable care. For example, a heart bypass surgery costing $100,000 in the United States might cost $7,000 to $10,000 in India, with comparable outcomes. Burkina Faso, by investing in similar infrastructure, such as CT scanners, linear accelerators for cancer treatment, and intensive care units, could offer competitive pricing for regional patients, undercutting the costs of traveling to India or Europe. The parallels with India extend beyond infrastructure. India's medical success is driven by its ability to train large numbers of doctors through rigorous, high-volume programs that emphasize practical experience. Burkina Faso's initiative aims to emulate this by scaling up its training capacity and ensuring that doctors gain expertise through real-world practice. The planned medical training centers will prioritize specialties that align with regional health needs, such as maternal health, pediatric care, and infectious diseases, while also introducing advanced fields like organ transplantation and precision medicine. By doing so, Burkina Faso could mirror India's ability to offer comprehensive care, from routine checkups to cutting-edge procedures. Moreover, Burkina Faso's strategic location in West Africa gives it an edge over distant destinations like India. Patients from neighboring countries could travel to Ouagadougou in a matter of hours, compared to the lengthy and costly journeys to Asia. Cultural and linguistic proximity. Many West Africans share French as a common language, further enhances Burkina Faso's appeal as a medical destination. For instance, a patient from Benin could receive treatment in a familiar cultural context, with care delivered by doctors who understand regional health challenges, such as malaria or malnutrition-related conditions. The healthcare initiative's potential to attract regional patients would also elevate Burkina Faso's diplomatic and cultural influence. As a medical hub, the country could foster stronger ties with neighboring nations, positioning itself as a leader in West African development. Hosting patients from Mali, Niger, or Togo would create opportunities for people-to-people exchanges, strengthening regional solidarity and aligning with Traoré's Pan-Africanist vision. These interactions could pave the way for broader cooperation in areas like trade, education, and security, particularly as Burkina Faso seeks to reduce reliance on Western partnerships. On a global stage, Burkina Faso's healthcare ambitions could draw comparisons to emerging medical hubs like India, Thailand, or Turkey, which have leveraged medical tourism to boost their international profiles. By showcasing its ability to provide high-quality care, Burkina Faso could attract attention from global health organizations, potentially securing grants or technical assistance to further enhance its system. This exposure would also counter negative narratives about the country, often dominated by reports of conflict and poverty, by highlighting its innovation and resilience. For Burkinabe doctors, the international exposure would be transformative. Treating patients from across West Africa and collaborating with global medical institutions would position them as regional experts, enhancing their professional prestige. This recognition could encourage more diaspora doctors to return, bringing with them skills and networks that further elevate Burkina Faso's healthcare system. Additionally, the opportunity to work in a high-profile medical hub would inspire young Burkinabe to pursue medical careers, creating a pipeline of talent to sustain the initiative's long-term goals. The influx of regional patients would amplify the economic benefits outlined in Traoré's vision. Beyond medical fees, the hospitality sector, hotels, restaurants, and transport services would see increased demand as patients and their families travel to Burkina Faso. Local businesses, from pharmacies to food vendors, would benefit from this economic activity, creating jobs and stimulating growth in urban centers like Ouagadougou and Bobo Dioulasso. Rural clinics, meanwhile, could drive development in underserved areas by creating demand for local services and infrastructure, such as roads and utilities. Socially, the initiative would reinforce Burkina Faso's commitment to serving its people and the broader African community. By providing care to regional patients, Burkinabe doctors would contribute to a shared African health agenda, addressing diseases that transcend borders, such as Ebola or tuberculosis. This sense of purpose could further reduce brain drain, as doctors feel motivated by the opportunity to make a regional impact. Additionally, the presence of foreign patients could foster cultural exchange, promoting mutual understanding and reducing regional tensions in a volatile part of the continent. Realizing this vision requires overcoming significant hurdles. Equipping clinics with advanced technology demands substantial investment, and Burkina Faso's reliance on nationalized industries like gold mining introduces financial risks tied to global market fluctuations. Supply chain challenges, such as procuring specialized equipment or pharmaceuticals, could delay the operationalization of new facilities. Ensuring consistent quality across urban and rural clinics will also be critical to building trust among regional patients, who may initially be skeptical of Burkina Faso's capabilities compared to established hubs like India. Security remains a pressing concern. Ongoing insurgencies in northern Burkina Faso could deter foreign patients and disrupt the operation of clinics in affected areas. The government will need to prioritize security measures, such as protecting medical facilities and ensuring safe travel routes for patients. Additionally, building a reputation as a medical hub requires consistent marketing and diplomacy to convince regional patients and governments of Burkina Faso's reliability. Training doctors to handle the influx of diverse cases also poses challenges. The medical training centers must maintain high standards to produce globally competitive physicians, which requires qualified educators, updated curricula, and access to cutting-edge research. Without these, Burkina Faso risks falling short of the expertise needed to rival countries like India. Furthermore, the government must ensure that doctors are adequately supported with resources and manageable workloads to prevent burnout, which could undermine the initiative's goals. Traoré's healthcare initiative, with its focus on advanced equipment and regional appeal, has the potential to redefine Burkina Faso's place in Africa and the world. By attracting patients from neighboring countries, the country could generate significant economic and diplomatic benefits, while providing its doctors with the experience needed to compete on a global stage. The ambition to rival medical hubs like India reflects a bold vision of self-reliance and excellence, rooted in the belief that Burkina Faso can lead the way in African healthcare innovation. As the initiative progresses, its success will depend on sustained investment, strategic partnerships, and the ability to navigate the complex challenges of a nation in transition.